Hey everyone, this is Amanda with Bright Futures Families, and I am the director here, and I have today's Ask Question, and the question is, do intended parents have requirements too? This is a great question, and yes, they do. Intended parents do have requirements as well. A lot of people think that only surrogates go through screening, but intended parents have certain requirements they need to meet before starting the surrogacy process as well. Most of these requirements actually come from the IVF clinic where the intended parents are working with. Every clinic has its own policies and guidelines, which can include things like age, medical history, and overall health considerations. Because of that, choosing the clinic that fits your specific situation is really important. In addition to clinic policies, there are also guidelines from the American Society of Reproductive Medicine, or ASRM, which many clinics and agencies follow. These guidelines are designed to make sure the surrogacy journey is safe, ethical, and supportive for everyone involved. So, for intended parents, this often includes a few key items that for their screening. So first, there is usually a psychological or psychosocial consultation. This is typically a clinical interview where a mental health professional talks with intended parents about their readiness for the surrogacy journey. Surrogacy is an emotional process, so this step helps ensure that intended parents are prepared for what the journey involves. Second, if the intended parents are providing their own eggs or sperm, there is typically a medical screening. This can include things like infectious disease testing, similar to what the surrogates do. And in some cases, especially if donors are involved, there may also be genetic screening to help ensure the healthiest possible outcome. Beyond clinics and medical guidelines, agencies can also have their own criteria. This helps agencies manage wait lists and make sure they are working with families who are a good fit for their program. So, for example, Bright Futures Families, we do have a couple of program requirements. We currently work with intended parents who have a documented medical need for surrogacy, and at this time, we do not work with international intended parents. We just feel like that's not our forte, and there's other great agencies out there who do a wonderful job at that. Every surrogacy journey is unique, and requirements can vary depending on the clinic, the agency, and the individual circumstances. But overall, these steps are in place for one main reason: to make sure the process is safe, well-informed, and successful for the surrogate, the intended parents, and ultimately, the baby. I hope that helped answer your question. Have a great day.